Welcome back, everybody, to the Functional Code. We have our next Bulletproof series episode, Bulletproofing the Hockey Athlete. We got a great podcast today. We're going to be talking injuries, concussions, and the like. So today, I am Dr. Addy.
I'm Dr. Jace, and yeah, when we were sitting down going through the Bulletproof series, we wanted to find a couple larger sports that most people play. Hockey was on the list, and as we keep going through, we're going to keep touching on some of the major sports and breaking down different positions, but especially for hockey, this is something that if you're up north, especially Canada, northern United States, or any of the larger cities, they almost all have hockey built into them. So this is a growing sport that keeps adapting, keeps moving forward, keeps going towards skill development instead of what was known as back in the day as tough hockey, more for brute force, if we will. So yeah, as we go into this, we're going to break apart everything and how to build up the athlete in terms of handling past common injuries, for the rehab purpose of rebuilding some of those areas. And then as we go into this portion, concussions are incredibly important to tackle, especially for skill development, and not only in the hockey, but also in life in general. And Doc's going to do an awesome job with that. And then we're going to go into other aspects of what mental mind frames you have to look at in terms of building up oneself.
Yes.
And then we're going to touch on Gary Roberts, who has trained Sidney, Crosby, McKinnon, McDavid, so the high-end athletes, and what does that training look like? And then we're going to get into some other fun things in terms of how does AI play into this? What is Sidney Crosby's past traumatic brain injury? What does that look like? And then we're going to finish out with a fun other couple small things to be a surprise for the end. So as we dive into this, Doc, for the common injuries, with the amount of padding that hockey players have, many people think that they wouldn't get injured, but there's way more injuries that occur that people may not realize, especially even if you're playing hockey, that we want to touch on and discuss that a little bit more. But
And Doc, you played hockey growing up, right?
Yes,
so when
sir.
did you start, and how did that look for you as far as your journey?
I learned how to skate before I learned how to walk.
Dang.
It's one of those where, less than a year old, and parents were having me on skates, and then pretty much played all the way through high school. Got a chance to do some officiating and reffing as well. So, and then also worked at the hockey rink. So
you're no stranger to the skates, right?
Definitely not.
Yeah.
It's definitely in my blood. So in terms of common injuries, because I know that a lot of them are like scrapes, cuts. I guess, Doc, what have you noticed? Because I know you're from Minnesota, Midwest.
And I, believe it or not, didn't even play hockey. I wish I could have. I was in such a small town, we didn't even have it. So it was unfortunate. I wish I could have, because I love hockey. It's one of my favorite sports to watch. I'm a incredibly diehard UND Fighting Sioux fan. I went to UND college hockey town. So again, it's in my blood in a different way. But yeah, from and what I found online, I really scoured the internet to really figure out what most athletes face as far as hockey players. Obviously, Doc, you played the sport, so correct me if I'm wrong here when bringing this stuff up. But a lot of this I got from a professor of orthopedics and co-director of sports medicine at the Mayo Clinic in Rochester. And this guy, I think he's also now the chief medical officer for USA Hockey. I mean, he's done it all, been there, done that. His name is, I believe, Dr. Stewart. So what they found, obviously, cuts, scrapes, bruises are super, super common. Obviously, when it gets to more major injuries, broken bones, sprains, and strains. But concussions usually are the most common. After that, it's injuries to the face and mouth. So again, it's all head and face is really an area of concern when you are in this sport. After that, wrist, hand, and finger being a sport where you have to hold a stick. I'm sure there's just different points of grasping and needing to use to give yourself the advantage. So that also brings upper arm and shoulder injuries. And then lastly, you're on skates, which is already a unstable form of movement in a way. So there is ankle, foot, lower leg injuries that can come from that. But they say 1 in 4 ice hockey injuries are to the face or the mouth.
I see that.
In young hockey leagues, they require kids to now wear neck guards, which I believe came from an instance where someone had gotten an injury to the neck. I think that's still common today in NHL. I don't. Do they wear neck guards in the NHL?
They're not required to, but yeah, this player, I think it happened last year, and now, so he got severed in the neck. I think he bled out, died, and this was actually in like a higher end level. I think it was like the elite hockey league. You think about the youth, and I know in Canada they require neck guards
Just
from
across the
youth,
board?
across the board
Yeah.
with everything. And now I think this year or last year, now they're requiring it with all USA hockey, but.
Sure.
Yeah, we can't have anyone dying.
Well, that's unfortunate because I'm sure it wasn't anything other than a freak accident. And, it's crazy to think that more people have died in this sport than others. You wouldn't have expected that, especially from that mechanism of injury, unfortunately. But yeah,
So true.
he included in his paper, which was titled Prevention of Ice Hockey Injuries, that players were 25 times more likely to be injured in a game than in practice, which it shouldn't be surprising to hear, but that stat is surprising, that you're literally 25 times higher chance. That is so immense. So competition, players that are going to be actually playing in game versus just, training or just doing it for fun, you got to understand that the risk now has increased that much, and parents and players need to understand that moving forward. Non-uniform facial protection among players led to numerous lacerations. Of course, again, just got to have most of them argue to have full cage versus just the visor, right?
Yes.
A study on high school ice hockey players found that almost all injuries occurred during the games, mainly due to collisions. I doubt you really can avoid that, but if there's even a way to train around that. Fatigue was a significant factor with players in the high school playing time group, meaning when you're high playing time, so those who played longer and were more fatigued sustained more injuries, whether that was due to them on the ice more or if they actually fatigued. I'm not sure which one was a higher correlation, but that'll come up with how to train for conditioning, making sure that the AI portion of this is going to be interesting because they are now trying to understand how to avoid that fatigue portion of things, and they're actually breaking that down, which is interesting. Lastly, high stress and preseason injuries were near significant predictors of injury during the season, and studies showed that forwards and defensemen were the most susceptible to injuries. So,
And I could see that. Even from like practice to game, like practices, when you go through it, they practice like set plays, game situations. But when you go into a game, the variability of the opponent wants to do whatever they can to score a goal. And that may involve some moves, penalties that will force you into different positions that you may not are normally used to.
is there
even
contact in
practicing.
practice, Doc?
You can, yeah.
Yeah.
It varies. And going back to, I think in high school at this time, if not just out of high school, and they changed the level in which you could check from, it was early like peewees. So in terms of the tier system, it goes from mites, which are kids, anywhere from like 5, 8 years old, give or take. I'm probably off a little bit on that age range, to squirts. From squirts, it goes to peewees to bantams, and bantams to either high school or other high-level tiers.
Okay.
So when they look to go from checking, it started off in peewees, so this would be like anywhere from ages 12, 13 years old. Now that got pushed a little later, and now kids are learning to check a couple years later in the bantams, which is really close to high school. So kids are learning to check instead of just like stick checks against the wall. So I think that also has progressed the game to more of a skill fashion, but that's also where if they don't know how to check or absorb the check or get out of potentially getting checked, that there's injuries that can come up from there. So I think
I know
that's
there are some parts in here that I included too with that. I'm sure you'll be able to talk on that too.
Absolutely.
My question, I don't know if maybe others who haven't played hockey before, at least moving through the ranks, but you can check in high school.
Oh yeah.
Is there limitations to the check, or is it a full contact, no regulation of how to check?
Yeah, there's limitations, and it's also different from males versus females. Females, it's more of a rougher checking the stick, taking their hands away than completely at the body.
Okay.
I don't know if that rule has changed in the last like 5 years or so. If it has, then I'm a little off on that one. But in terms of the intensity of the check, you want to monitor, like looking from an officiating standpoint, nothing to the head.
Okay.
Hands can't come up, elbow can't come up, going straight at the body or using the hips or the side of the body, either straight at theirs or into the boards from there. And then also, if you think about it, and this happened in the finals when the Oilers were playing the Panthers, and it happened twice, and how a player got out of the way, but the person trying to check them got their feet and legs, which can blow out a knee quite a bit, and then has led to penalties and game misconducts from there. So
they became tangled?
So, like, the player tried to get out of the way that was going to get checked, and the one that already committed towards the check missed the body, but their body got the knee, ankle, feet, and then that can cause injury from there. So
is that a penalty?
it would be known as either kneeing, which my wife gives me crap about because she's like, there's no penalty called kneeing. It's actually a real thing. Or you can call it tripping, either or you want to call it. But yeah, not ideal.
Yeah.
For player protection, safety, more
sure.
or less. But another, I think, absolutely common injury, concussions. And I know I've had my share of probably 1 or 2 concussions. For one, I was playing in high school. I don't remember much other than feeling like dazed, but I continued on through the rest of the game concussed, and apparently I had one of the best games I've ever played in my career. I don't remember anything.
Wow. That's scary.
Weird. So I remember a part when I got checked, sitting on the bench, dazed. And then I remember sitting in the locker room afterwards feeling like I was going to throw up. And this was in Minot, which is about an hour and a half away from Bismarck, hometown. And so we had to travel on the bus on the way back. But that was a situation that I definitely noticed like brain fog afterwards. There's like the cognition and recall definitely was diminished after that.
Yes. So, Doc,
School,
in
all
your
that,
words, as a doc,
Yeah.
did the trainers do a proper job of checking you out after that head injury?
Definitely not. And I think they didn't really have, so the trainers that they had in place weren't certified. So it was based on like the coaches, a lot of it on myself too, wanting to play through it, like as an athlete, playing through an injury for the betterment of the team is a whole thing. But
of course,
not the smartest thing on my part, especially looking back at it. But at that time, obviously I wanted to and continued. So
for sure.
But yeah, now it's not smart.
Concussion is a tough one because it's easy to miss. There are a lot of signs and symptoms that you need to be able to pick out as a trainer, doctor, whoever you are on the team to make sure, even in any sport. And the most help, of course, is screening before you even start the sport is going to be huge because it can pick out things that you maybe are lacking, weaknesses that you have. Maybe you've suffered a head injury before and you're still recovering from it. You got to have appropriate screening first and foremost, and that's with any sport. So that would be the most essential, in my opinion, if you are going to have a kid in sports, making sure that they do have. And yes, I know a lot of the schools provide the screening for the team, but if your kid has already had a head injury, in my opinion, and again, this is just opinion, there might be some top high-level schools that actually can create that environment with high-level docs or high-level, but in cases of yours, like you said, they didn't probably have a lot of that. And so that's where I would maybe choose to forego that route and actually put them in with a doctor or a higher level, neuro, someone who knows how to properly screen, because it's going to make only a huge bit of difference moving forward in that player's life. So you got to have an appropriate assessment after the initial concussion, because if you do sustain a concussion, your risk of getting another one is now 4 times increased. So, and the more concussions you have, the greater chance moving forward of having long-term issues, dementia, Alzheimer's, you name it. Just it's going to make a difference moving forward, away from sports, right? Yeah. So.
And Doc, you actually showed a video of a brain in a skull and just a little bit of movement, and it jiggles kind of like Jello, which is crazy.
Yeah.
And if you even think of a contact to the head and how much movement that is.
It does. It looks as though it's I would say, almost like like jello. It looked
Yeah.
like jello, the consistency when it was getting shaken. And that puts into perspective just how fragile the brain is. And I don't think a lot of people understand that's how fragile it is. So any type of whipping motion, any type of head injury, it does create this large impact against the side of the skull. And with that is going to come major signs and symptoms that might present right away or might present later on down the road. Some of the things that, as a parent or as a trainer, even as yourself, you have to assess yourself if you have after this kind of injury is going to be confusion, even loss of consciousness, forgetfulness. Those are the big ones, but dizziness, nausea, loss of balance. You might see flashing lights, ear ringing, double vision. You might feel sleepy. You mentioned you've had a couple that you think. I have too. What I remember was I don't remember. So my forgetfulness was the big one. I don't remember how I got to that point. And as a player, you should mention that to your trainer. I know playing through the pain or playing through the scenario is going to be crucial for your team. You think that, but it's also going to be just looking out for yourself and your longevity moving forward. So you got to be able to try to explain what's going on. If you can, obviously, if you don't know where you are, the trainer should understand that you are dazed and confused, and that's going to be a number one. And so those are going to be some symptoms that you might have. Other signs would be your poor coordination. You're not going to be able to, in this case, maybe skate off the ice in a linear fashion. You might not be able to answer right away. You might not be able to concentrate. You might have someone just who is staring off into space and they can't even make eye contact. In severe cases, you might have slurred speech, just abnormal behavior. These are all things that you need to look out for. Now, that's in the acute setting. Long term, or even over the next week or two, you'll find, again, ability to not recall. That was one for me, too. I couldn't remember words. I couldn't remember finishing sentences was difficult for me. I noticed that moving my head in certain directions made me dizzy or made me it almost felt like I had vertigo in a way. Wow. So if you notice that you're looking one way and you feel this sense of dizziness, you got to realize that you had a concussion. And those are things you got to pick out. Lastly, sensitivity changes to noise was different for me. Sensitivity to light, driving, those kinds of things. Those are all important when identifying concussion. So,
Doc, question for you, because I was always told after having a concussion, they say don't fall asleep or take a nap afterwards. Is there a reason why?
So that is a myth. Sleep is going to be important for brain recovery. We now know that. The only things that really we want to look out for are signs of a brain bleed.
Okay.
And those, my assumption with the anecdotalness of those stories is because they had a severe injury and they unfortunately passed in their sleep.
Oh, wow.
Because they didn't understand that they actually had a more severe injury other than the concussion. So hemorrhaging of the brain, other types of more severe injuries. One common sign is called battle sign, and it's purpleness behind the ear, and it just shows pooling of the blood from a blood bleed.
Okay.
Other types of signs of a brain bleed will be just immense pain in the head, headache. I mean, we're talking a headache you've never had before. It's 10 out of 10 shooting. It's really, really uncomfortable. That's going to be another sign. Lastly, you will just be very disoriented once that is starting to happen. So you're going to need to pick those out. And if you sustained a concussion, even a mild concussion, go see a doctor. If you're with a trainer at the game, my hopes is the trainer is aware enough to pull you out of that game, but don't just send the kid home with the parents and say, trainer's going to say, yeah, just let him sleep it off, whatever. No, it's time to go get a proper assessment because I hate to sound so severe, but your kid's life will depend on it.
So true.
It is, you have a 90-day window for permanent damage to set in.
Wow.
After 90 days, there are studies showing that you cannot come back from these types of head injuries. What was done was done. And the neuroplasticity window of 90 days is so crucial to redeveloping the pathways that were broken down from that head injury. And that's where, a lot of functional neurologists that we'll get to do such a great job of rewiring, training, and making sure that these kids that get concussions recover fully in that short period of time before the long-term chronicity sets in. So let's say you left the ice, it's been a day or two, you go see a doc. There are definitely still signs that you can pick out with injury. Now, that's going to take a more skilled practitioner and someone who knows how to extract the more subtle signs. And so with kids or even adults who get a head injury and feel fine or even appear to be fine after a day or two, there are still things you can do testing-wise that can create or show aberrant breakdown of these pathways. So one of the ways that we did that was what's called a visual nystagography. And it just is a wearable face set that helps measure eye tracking. And it's very hard to pick out these aberrant breakdown of eye movements when you're moving your eyes, but it is almost, I would say with those who have a head injury, almost all of them will have breakdown in eye movement. It's just very correlated. So we would take them through certain eye movements. We would do testing with the eyes. We would do certain games in a way. And we could see these either, first thing we'd look for is nystagmus. We'd have the type of nystagmus most practitioners know about is just the beating of the eyes with certain movements. But there are different types of nystagmus too. You have downbeat nystagmus. You have just like permanent nystagmus of someone who was born with it.
Oh, wow.
And then you have nystagmus that is invoked upon doing Epley's maneuver. Again, I'm not a chiropractic neurologist or a neurologist, but these are just the things that we would pick out. And you could only see that using this software because it's very tough to pick out to the naked eye. And those are subtle signs that give us info that you did have a brain injury or you had a concussion, and you would never been able to pick that out just by assessment on the ice, on the bench. You just would never have been able to. So it's those types of testing that is crucial and essential, and you should be done after a head injury.
Fascinating.
To know.
And I know so many hockey parents, they're going to think the kids are fine. In the back of my mind, I'm thinking, okay, are there any small tools that you can do from a coach or parent standpoint to check and see concussions? I think the best rule of thumb, if you think there is a concussion, roll off on the safe side, pull them out, and get tested by a doctor practitioner.
Yeah.
But
I would say, and again, this is my opinion, and I know a lot of parents are going to argue, even trainers might even argue, but if you feel they sustained a head injury, I just wouldn't play them.
yeah,
If you have a solid 10 to 20 step screen and they pass them with flying colors, then yeah, then I would feel comfortable.
Okay.
But if they fail even 1, 2, or 3 of them, I'm going to be hesitant, and I would just put them out the rest of the game. And better to be safe than sorry.
100%. What does the time frame look at in term? Well, and obviously it depends on where the concussion would be at in terms of either the small brain bleed. But typically, how long does the duration last for in terms of getting back to play?
Yeah, so if it was a really, really bad concussion, we're talking anywhere from a month onward. I mean, it could be more.
Wow.
I know Crosby's was so bad, I think his was 8 to 10 months. But he had multiple, so that's another factor. So if it was a mild concussion, again, it's going to vary between practitioners, but it depends on how quickly they are able to move through the trainings and be able to recover. But you know, when we trained athletes that had concussions, it wasn't uncommon for them to take a month to 3 months to recover in our setting in terms. You know, other practitioners maybe have more leniency, and I'm not saying that's okay. I'm just saying they might have different settings and tests that they choose to bring them back to play.
Okay.
But we were so anal about making sure that these players were 100% ready to go. Again, we know that second concussion is going to more than likely come if they don't recover of 100%. So we were constantly testing them every time they came into the clinic. And if we felt there was still some just discrepancies in what they were like prior to the injury, we were still considering them not having them play. And unfortunately, we had seniors who we took out for the rest of the year. They didn't play that senior year, and they were depressed, and they were upset, and they were mad. And I know it was, I mean, it really is difficult because you could just see the light kind of go out of their eyes when this information was passed to them. But as a provider, you have to be able to disassociate yourself from that because this is their livelihood now. I've seen the opposite end of that, where you had, 30, 40-year-olds who played sports, heavy sports, would come in and they were good, but then they got into a car accident and it was that final third or fourth head injury and they couldn't even provide for their family anymore. They couldn't even drive a car. They couldn't even stare at a computer screen for more than 30 minutes, and that was their job. They worked remotely, and they didn't even feel like a human again. And so that's what I'm trying to avoid. That's what, as practitioners, we should be thinking about is it's not about getting that final glory at senior year and getting to say you played. It's making sure you have a life after sports.
Absolutely. Yeah, there's more important things than sports, even if you're the best in the world. Like, you can't stay at the top end level for most sports for a majority of your life without consequences of injuries, and if so, then, like, especially for concussions, man, we're dealing with brain and how the brain controls everything throughout the body, which makes a lot of sense.
For sure.
Yeah.
And with head injuries might come neck injuries, so you also want to make sure you screen, did they get a neck injury along with the head injury. Whiplash is, again, another common cause of a brain injury, concussion. So with the whiplash, we've seen obviously too with motor vehicle accidents, the neck is usually affected in some way, shape, or form.
What training do you typically do for concussions to accelerate them other than just rest?
So rest was, of course, is going to be helpful. Making sure that we remove any triggers that are making their symptoms worse. Okay. Light, sound, movement. It just depends on each patient, but we want to make sure that any triggers causing symptoms we want to reduce because we don't want the patient to feel worse. So assessing those, making sure that we can remove those in the short term. So we had this philosophy, this mentality that if we could get you to doing the things that, almost like how we train here, it's training in what makes things worse. So, for example, we had a race car driver. He raced cars, and he got an injury while he was racing cars. And for him, there was, I think, a little bit of a psychosocial aspect too, where anytime he got behind a vehicle, he got dizziness and vertigo. And he had this for months to years after this. And he never, in the time that I was at the clinic, he never raced again. Now, I don't know if that's the case anymore, but this was years past. Wow. And any bit of movement in a car would cause these symptoms to come back. So we would train him and we would push him to drive. We'd say, okay, next time you come see us, don't let your dad drive, you drive. And we had got to that point now, right? Like in the beginning, we wanted to make sure he was okay to drive, but it was that progressive mentality of we're going to push you back to what is making their symptoms worse. So, we had a gentleman who got into a motor vehicle accident who worked remotely. So he could only stare at a screen for 20 minutes. Well, we'd push him to 30. We'd push him to an hour. We'd do things that would task his body and test him so that we could push them forward. Other things that we would do, we had technology in the clinic that helped along with recovery. It was sound technology, frequency technology. We had eye tracking and neurostimulation, those kinds of techniques and softwares that helped to train eye movements and head movements and being able to work with the vestibular system, eye tracking, all the cranial nerves, those kinds of things. Yes. We'd had what's called a CAPS machine, which was a computerized assessment of postural screening. And so that was able to test balance, and we were able to see what balance was like when you moved your head one way versus the other, and did it change eyes open versus eyes closed. And if it was worse, eyes closed, we would train you with your eyes closed. We would push you that way. We would try to test to see, is it the eyes that need help, or is it the actual vestibular system that needs help? So if a patient was better eyes closed, versus eyes open, we knew the eyes had a big part to their balance. And so we would train eyes versus, let's say eyes open, they were fine, but they closed their eyes and their vestibular system was just whack. Well, then we do a lot more eyes closed testing to try to, build up proprioception. So it's really just, you got to know how to take all of these systems and rule them out or together and then know how to train forward.
Man, that's so fascinating. Well, after school, having a good understanding of concussions and the severity and the importance of making sure those heal for the long-term standpoint, like we have a decent idea. But when you go into the functional neurology, which you have a bunch of experience with, and even from some of the other stories that you said in the past too, like it's incredible how well you can change and adapt someone, not only from an injury, but even for training them in their eyes, which I think we'll get to probably with the Sidney Crosby part, but I had no idea. Doc, is there any other studies found with like the USA hockey for like visors for risks?
Yeah, I think Ali also included that obviously face masks reduce eye injuries. No permanent eye injury has ever been reported when wearing certified masks.
Oh, okay, gotcha.
USA Hockey funded a study that showed 4.7 times greater risk of injury with no protection compared to a visor. And then no eye or neck injuries occurred in players with full protection, meaning I think full guard.
Yeah.
And I know I won't say who it is, but recently we've had a colleague of ours who was slammed into the boards and he had full gear on and it did injure the side of his face, but his eye was protected, thankfully, using that cage. And so again, it's crucial, I think, to wear that guard.
I would agree. Now, as we go into other injuries, so I know we touched on the concussions ahead, and we're going to dive back into that a little bit more, but I know there's other injuries of the shoulders, elbows, arms, knees, ankles, feet, and then also one of the mid to lower back. And this is something that I see quite often in terms of that mid to lower back, the thoracic lumbar spine. Especially if you're going to camps and if you're not used to shooting or passing for the amount of reps that you do outside of that camp, you might start noticing this strain, this pulling sensation in the back. And we even see this with baseball players in terms of swinging camps. For the common movements that you do over and over and over again, that helps, one, obviously lay down muscle memory and attaches the nervous system to motor units, which helps build up the tissues. But overuse of those tissues can lead to strain and compensations from there.
Yeah.
Which, like, if you're going to do anything, if you're going to train, like, let's say if I shoot lefty or left-handed, I would also want to do training in the opposite direction, even though it feels weird, for combating the amount of reps.
We talked about that with golfers too, right?
Yeah, absolutely. Yeah, good point. But for that, let's dive into like the shoulders, the elbows, knees. Doc, what have you found through some of the studies in your literature and even experience and observation from injuries with hockey?
Yeah, and I want to touch just quickly on the neck. I actually want to, it could be a good question for you. So I found neck injuries are usually due to a blow to the top of the head. Now you said that's obviously illegal, but in this study done by the gentleman from Mayo, he said that vulnerability of positioning is crucial on avoiding this kind of injury. And he said, in here he talks about how you should train your players to keep your head up during some type of contact. Don't duck method. Now, is that something that do you understand what he's talking about there?
Yeah, that's where, like, and if you have the puck and if you're looking down, just the control stick handle, when your head's down, if you get hit, a lot of it's going to be due to whiplash symptoms. It could be the same thing as if you're along the boards and the puck is at your feet and a defender's trying to get it and you're just trying to shield it or waste time against the boards, not looking down because other people can come in and just clothesline you. So keeping your head up, seeing who's around, and if someone's coming, have a decent understanding, okay, do I have to switch my body in a direction? But that's also comes due to strengthening the neck as well.
Yes.
In terms of a rotation standpoint and also tilting in different directions. So in terms of the ducking method, anytime your head goes down, people you might not see, so where you can brace can impact, especially in checking
Sure.
from there. But yeah.
And I know studies are now showing when you do a proper training program, strengthening the neck muscles can actually limit concussion or severity of concussion,
Yeah.
because your ability to brace once that impact is there or prevent anything should absolutely be included in conditioning. But yeah, no, I was curious what that meant.
that.
Moving forward to shoulders, the study showed that the common injury is usually a shoulder separation. Again, that just is how what'll happen is the ligaments around the shoulder tear, and the connection between the shoulder blade to the clavicle is disconnected in a way. So it occurs usually when the player hits the boards or another player, and that blow force creates that injury. Moving on to the mid-back, low back, you had talked about that compensation that can happen from just overuse of slap shots, other types of movements. Again, if the body's not used to it, you're going to feel sore and you're going to have those pains, I guess, if you could say. So, and I'm sure there's a lot of, from what I view, when you are skating in hockey, there's a lot of flexion to hockey.
Yes.
So the apex of the flexion can come through that TL junction area.
Absolutely. Every stride.
Right. So building that area up, I'm sure, is incredibly crucial for the longevity of the sport.
Yeah, and even looking at it from like the hips, so like any like hockey skating movements are not normal. Looking at the legs and feet, hips specifically, so every hockey stride length goes more out to a diagonal fashion versus running. So when you look at the ball and socket joint of the hips, and this is where common groin injuries occur too, with movements of either opening up the legs to change direction or every stride going forward, or even skating backwards at angles as well. All the twisting motion absolutely comes mainly in the mid to lower back junction, but if there's compensations of other past injuries to the hips, that will also force the mid to lower back to take the brunt of the force against either every skate stride or every check. But that kind of plays hand in hand with one of those.
So stabilizing that girdle is a absolute must for
Yes.
stability throughout the whole body.
Yep, core to extremity movements.
For core to
with
extremity,
everything.
sure.
Yeah.
If you get checked while twisting, knowing how to skate away from that or to at least brace for that can obviously limit the lower back to mid back injuries. The elbow seemed to be a frequent point of impact. That, kind of contact maybe with others or banging against the board. I don't know is that usually where that contact can happen.
Yeah, elbow injuries don't happen too often.
Okay.
Like the elbow guards, they're pretty thick and they have way more support than any of the elbow guards that we've had, especially when I was growing up. All that technology and safety equipment has adapted significantly. However, you do notice a mixture of like wrists and elbow injuries, either like you said, getting checked in the boards or with common stick handle movements, and you work into a wrong position that you're not typically trained or normally used to, and then they can give out more of a stress strain instead of a fracture. But if your feet come out from you, or if you run into boards, or even a puck hits in the right spot to where there's not as much protection, it actually can cause breaks, a bunch of other problems from there. But yeah.
Knee injury seems to be makes sense, right? But they said the most susceptible to injury was the MCL. Do you agree with that, Doc?
Yeah, especially with stride length on going in, but even for people being checked out off to the side, especially as you go and turn. Like if you're trying to cut and turn out of the way and someone falls on you, you can give out really easily versus the outside portion, to where anytime you lean or turn a direction, your body usually goes in the same direction, which is harder for that LCL or that lateral collateral ligament to give out.
Okay.
But then, yeah, the MCL kind of works a little bit with the ACL to a certain extent, but yeah.
Yeah, like you said, vulnerability of the knee is what he had put in there. Like yeah, pretty much exactly what you just said. He had put in just what happens when the MCL is damaged. Complete tears, he said 8 weeks to heal. That's pushing it for me, but I'm not sure. Unless he's doing maybe surgery plus rehab is my guess.
That would be my assumption, yeah.
ACL disruptions can happen too. Meniscus tears are usually less common, but that's kind of the extent of the knee. As far as ankle goes, sharp skate blades can cut the lower leg. Is that common? Do you see a lot of that?
It's actually more kind of common in terms of injuries. Like this happened to a high professional athlete. It was Jack Eichel.
Oh, really?
And it was more of a high ankle sprain, but I think he also had a skate hit him too. Not the same instance, but in different instances. We've seen other athletes get cut off to the side too, because where the skate goes in terms of like the ton. I always used to put shin guards over top, but even for individuals that either the stick gets brought in there, or a skate as you're moving, especially in the corners trying to battle for a puck. It happens more than you think, but not terribly common, but enough.
At least in the what you're wearing uniform wise can somewhat protect that, obviously.
I think it was Alex Ovechkin or another high-end level hockey player. They cut off the ton because they didn't like the restriction.
Okay.
And that exposed everything ankle-wise, which can also lead to high ankle sprains. But
So the tongue does have a
yeah.
utility, you would say.
Yeah.
Okay.
Yeah, there's a special guard that now when skates are a lot lighter instead of the thickness to prevent injuries, much the same like that.
Sure. Okay.
Like there's some cheap, dirty plays that. So our high school hockey coach, Mike Peluso, he played professional. So we got a chance to get his 2 cents on. And when he played, it was definitely a rougher sport of hockey than it is now. But there's small similarities in terms of how well you can get under the opponent's skin and mentally frustrate them. On face-offs, tapping the top of their skate to where it's a little tender, or on the backside, or going behind their back foot on the face-off.
Just to get under their skin a little bit?
Yeah.
So a little dirty tactics here and there?
Yeah, you learn a few things.
That's
as
funny.
you go through.
I remember I was watching, so I've gone to so many UND hockey games now, and I remember it was UND versus Wisconsin. I must have been 19 years old. So that was about, gosh, I don't even want to say how long ago that was. So it was dead play. The whistle was blown, and they were kind of all skating around, and I was ice side. I was on the corner ice right by the goalie,
cool.
and his name was Ramage, I think, from Wisconsin. And the UND guy had kind of just skated around, and Ramage was kind of just standing there, just chilling. And he come by, and I think he took his stick and he nut cupped him just a little bit. Nope, sure enough, they were on each other wrestling, but I could see that too. I always see little things that you try to get into their head, right?
100%.
And it's so funny to watch. So moving forward, getting into kind of the nitty gritty of it all. If you are a higher competitive hockey player and you're looking to obviously make huge strides in your game, there's got to be ways that you can bulletproof this body of yours to either prevent injury or really just push yourself to being a better athlete as far as conditioning and strength goes. So Doc, I know you have some thought processes, obviously playing the game, but you've managed, treated patients that played the game too. Why is it so crucial to obviously have leg strength, but even just breaking down some of the basics to puck control? Obviously, we'll get into the mental IQ of the game too, but let's start with just bulletproofing the body. Where do you start, and where do competitive athletes have the edge in terms of strength in their bodies?
Yeah, so to bulletproof the body, especially legs, we pretty much need to have a solid foundation. So when we look to build up the legs, everything's core to extremity movement. So what I mean by that is every stride that you take is all going to be coming from core, rotate out through the legs. Everything, if you reach your arms, coming back through in terms of a shot, in terms of a pass, it's all going to be through the torso. So we want to make sure that not only the legs have a solid foundation to where you can move in any position you find fit, but we also want to have proper communication of the brain and mentally thinking at a higher pace at the same time where your body can either control certain movements and also your arms. So there's like 3 different things in play between the puck handling skills and where your arms are at, either protecting the puck passing, to the mental side of things, where are the defenders at, where are you visually finding the open space, then also with your feet and having the communication to open up and find different positions to protect the puck, to get around a defender. So working and breaking apart the skill sets of the feet, legs, different skill sets of the torso, arms, and different mental mind frame and how fast you can think things. And this is what separates good professional athletes from the best. From college or high school level to college. It's how well you can work everything as a whole. So when we break apart these things, I'll kind of go into a few fun tactics that you may have not thought about. Like there's a bunch of different ways that you can go about training the whole hockey player, and that will be done through like trainers, skill coaches, so they can go more in depth on the nitty gritty, but certain things that they don't pay attention to, or things that you can use in your training outside of those camps or those coaching sessions is what I'm going to be talking about a little bit more. And I also want to preface this as I'm going to some of these specifics and basics. This is having a general understanding of how to skate, how to stop, how to pass, how to shoot the puck, how to turn your head on a swivel in certain game time situations. So I'm not going to be touching on more of a basics standpoint, even though I would rely on basics from training all the way up now to professional level.
Yeah.
Basics are going to be so important through everything. But let's say we're middle school, high school, we have the basics down. We want to get to as high level as we possibly can. In terms of building up the power of the legs, you want to build up strength in multiple planes of motion. So when you look at this, you want to go into a lunging standpoint, not only just forward, but also off to the side, in front of you, and almost like a 360-degree angle. And this is where I look at Connor McDavid, and I'll probably reference him a whole heck of a lot. Like I've assessed him ever since he was mid-teens playing at the OHL with the Erie Otters, and how fast he was and how his puck handling skills matched the speed, which you don't see that too often. It's usually you're fast, but you can't think at that speed, or you don't have the puck handling skills, so you try to push it around the people. But the couple of fascinating parts with him and how we broke apart his skating speed, he does quick, choppy movements, kind of like side shuffles crossing over in different degrees, especially off to the corners of 45 degrees in front of you or behind you. So you can gain speed up not just with every stride length, but in terms of crossing over and using the edge of the skate to build up the speed as you go along.
Sure.
And at the same time, as you doing those crossovers, you are better able to communicate your brain to the stick handling skills at the same time. So not only just building up the angles of lunges in different positions, but then going into different variations of speed. So whether that's running uphill, either straight, diagonally, doing broad jumps in terms of quick explosive movements to get to the puck or a defender quicker, and then to lower your stance to change direction however you need from there. So how can you implement those skills on the ice into a training standpoint? And a lot of this, you're going to have to go through sprinting, but ideally work on crossovers, and changing directions of your feet will help correlate better to the on-ice work as well. So
Sure.
it's going to be a mixture of plyometric work, of stationary, and then stationary to a dynamic setting in terms of like a 20, 50-yard playing field in terms of the training aspect. And I use this training not only just hockey, but also in other aspects of life. And I've done this for years. I just never talked about it. In terms of going out for a run, work on different shuffles, or not only just walking and running backwards, but changing and moving in the same direction. So for example, if I'm going to be moving in a linear direction, can I move in that direction but just change the way my body is facing? So I'm moving that direction. If I want to turn and change the way my body's facing, but still going that way, my head doesn't even have to be facing that direction. Can I do crossovers? Can I change from bringing the legs behind me and shuffles backwards in that same direction? And that change of feet and how well that can communicate to the brain in terms of moving in a direction, gives you more variability. To also implement that in your everyday life for any other sport, but especially for hockey, especially for guarding, blocking the puck from a defender taking it from you, to getting around a defender. I kind of like look at it as cross training in the streets kind of deal. So that's something kind of fun that definitely I would suggest working on. Now, in terms of puck handling skills, that's going to be something that you absolutely need for communication of your torso. So when you look at some of the high-end level athletes, especially, and I'm definitely a little biased watching the Oilers almost every game for, 8-9 seasons now. Leon Draisaitl, he is a big German. He can dish and pass in any angle, but the curve of his stick is almost flat like a paddle, and it's crazy long, so he can distribute the puck in different directions. But for how you can build up your passing and even shooting game for that matter is you need to go into different positions and work on strength and distributing not only the skill work of passing the skill, but also in terms of like wrist weights at the same time as doing those skills will help significantly. Obviously, getting the normal puck handling skills under control works incredibly well, and then moving in different variations.
So adding some resistance.
Absolutely.
Make it challenging, right?
100%.
For sure.
So you work at that, you find where the open space is, you pay attention to where the defenders are coming, and also your teammates, where they have tendencies to go. So you know your options, and then picking your head up. So obviously you have to have control of the puck, and then seeing what are the other variations. So the thing that I wish I had learned a little earlier on is the basic skills, but then to do those basic skills with the head up. Because as my career went on, I started then incorporating that a little later instead of earlier on. And I think that's where the earlier on, the better you can compile your skills when you have your eyes.
Kind of like a compounding effect, right?
100%.
The quicker you can get into that state of mind,
yes,
the years of that is only going to then exponentially add that on. As far as, I'm sure those kinds of high-end athletes got that kind of training early on because of who they had as a coach or trainer, maybe their dad or had a professional athlete in the family that could give them that mindset. But
absolutely,
for sure.
And even when you look at, and I find this fascinating, the high-end level athletes, I'm curious what their parents' mindsets are and where the training that the parents instilled into the kids. And a lot of it was the motivation of the kids to buy into what their parents are saying, or coaches, or what have you with that. And Connor McDavid's dad, he's taught and coached many other athletes. It's the Oilers and Panthers. If you're listening to this, I'm hoping the series is still continuing for possibly Game 7. But there's a player on the other side, Sam Bennett. He grew up playing hockey with Connor McDavid, and he said it in one of the interviews recently that Connor's dad was so smart on set plays, was so smart on positions and how to train the athlete. And then I look back also a little bit last night and also before on when David or Connor McDavid grew up, he was doing skills that college athletes were doing at such an early age.
Right.
And that's combining training of switching up different variations of the feet, plyometrics, at the same time as doing different skill handling work, at the same time as mentally visualizing and repeating back words or situations all at the same time.
Yep.
And then the more variability you add on that as stationary standpoint, and then to build on that in terms of dynamic fashion, either off ice, on ice, and then build up the skills, it just goes hand in hand. That's so crucial. Much from there.
That's cool though.
It's fascinating.
And that's, people sometimes just don't understand to the extent of how these professionals train. And if you actually have time to break down a video, I'm sure someone has done it just on what it takes to get to that next level. I know that they incorporate, I'm sure we've talked about this before, but eye training exercises where they're doing 20 minutes of just staring at a wall and moving their eyes so they can train that visualization for many, many hours. And just the grueling, putting yourself into that grueling state of mind, even just that alone and how much time they spent doing that on top of whatever else they're doing. That's cool that I didn't know that about Connor's dad though.
So
Which makes
smart.
sense, though, why he had an edge from the beginning, right? Which is, it's just how it goes. Some people will just have that edge due to the people they know.
And that's why I think there's certain parts to where you can create an athlete, but at the same time, like there's genetics. So like, let's say his dad wasn't as smart as he is. I think that would 100% limit his ability, because if he wasn't exposed to that setting, if he wasn't trainer taught conversations outside of practice, outside of the everyday games, on what they do in the off time. And Connor McDavid also had an older brother as well too, who competed also at a higher level, not professional, but to see that setting, and I'm sure the work ethic it takes, and then you surround the community of just Canada itself, and everyone talks about hockey. Hockey is the equivalent to Canada as if it was soccer, football to the rest of the world.
Right, right.
So you have the motivation, you have the purpose, you have the vision, and then from there having the smarts of specifics that you can train to maximize your potential. And if you notice gifts that you have that you can accelerate that even more so, then it gets into the constant everyday process of trying to better each and every skill from there.
Yeah.
But man, it's a perfect setting.
And getting to someone who knows what they're doing earlier on than not. If you don't know what you're doing as a parent, which is okay, not everyone's going to be Connor McDavid's dad,
Yes.
It's unfortunate. I'm sure there's a cost to it, and that's just how that goes. But if you are serious and you feel that your kid is serious, or you is listening as a player and wanting to get better are serious, figuring out how to get to the next room that's you're not the best at, right?
Yeah.
Continually putting yourself into those scenarios where you aren't the best and you get to push yourself, and that's what it's going to take.
100%.
We talked a lot about with like forward, center, defensemen, goalies. Does that change what they're doing? Do you know of any differences there?
Yeah, and a lot of this will go back to the mental IQ for positions. So like when you look at forwards versus defensemen, the mindsets on especially strategies change from position to times in the game to understanding penalty kill, power play, like special teams. That all is different, and a lot of it will come back to the basics of finding open space, where the tendencies of the defenders. Then that's just for positional players. Now let's take in consideration goalies. It's a condensed area, but it's preventing a puck from going in the net, and how well you can do that. Now in terms of when the hockey first started, goaltenders didn't have masks. They used their face, and there's goalies that have had broken bones, and a lot of respect to them. Then as the mask got added in, it helped for injuries, but it also prevented them from side-to-side movements. So then they opened up the eye holes and then created a helmet and cage from there. The other incredibly drastic change, especially for more goal scoring, was when they changed the pad size, especially of the knee shin pads, and how they got a little wider, a little bit bigger. And same thing with chest protectors, and then all the gloves and elbow guards from there. That all grew in size, which condensed the area of where the possibilities of where the puck could go. So as you look back at from the stats of professionals back in the day, where they did more standing up versus more conventional like butterfly style.
Yeah.
It changed the injury rate for hips and groins. So from moving side to side planes, you want to work in absolutely a frontal plane and build up the tissue resiliency of the knees and the ankles and the feet. Because a lot will you see for common injuries for goalies is side to side movements to where you're reaching quickly and try to extend to save the puck. And that extension, quickly moving across, if you haven't built up the groin strength or even the strength from going into a butterfly stance and up from the ground, it's hard, and that's where a lot of injuries occur in the knees as well as also with the hips. So the more you can better bulletproof those tissues on the muscles and tissues on the inside, outside the legs in a strength fashion, and then also a power, explosion, and mobility standpoint, the better you're going to be.
And I've been told goalies are, and correct me if I'm wrong, are kind of the quarterback compared to NFL. Like if you have a good goalie, it is a game changer for the team. I mean, I had a friend who was talking to me about how in their leagues it's like 15 to 18 as far as scores go, because just a good goalie is tough to find
God.
in those leagues because, again, it's just the separation of skill from, good to great to a completely professional goalie.
God.
Night and day differences.
Oh yeah, you can see it. It's a night and day difference. Now going back to the comment quarterback, I'd probably say the center would be
Center,
but,
okay.
But the goalie is definitely someone that is relied on way more, and they get the brunt of this. Like they get scrutinized so often based on how pucks go in the net, and anytime you're defending, you have to look at the whole team, forwards defending, defenders defending in front of them, because that'll have a direct reflect on their skills and what their capabilities are.
Sure.
But when you look at, for example, this year in playoff hockey, game one in the finals, the Panthers-Oilers, Bobrovsky, he stole that game. He was lights out, and you look at that goaltending skill level, you notice that his mental mind was there. He read and was anticipating certain moves that the Oilers have tendencies to do and for plays for them to score. So for him altering the game to read off what the tendencies are for those players and to steal a complete game where the Oilers should have won that. And now they're currently at this moment down in the series 3-1 in the 2024 Stanley Cup Finals playoffs. It is just a testament to it changed that whole structure of the series, which then is a psychological component of working uphill to where now they can't lose at all.
Mm-hmm.
But looking at it from a goaltender standpoint, if you are good, if you are pretty much mastering different scenarios, different plays, different moves, if you have all that at your arsenal that you can go to at a split-second notice, depending on what the game stands for, that I believe will absolutely set you apart from good to great, but you also have to rely on, you need a team in front of you to defend.
Of course. Yeah.
So
to give you an extra edge of not having to pick out so many goals or try to stop them.
100%.
They almost seem like an analyst, a strategist. Like you gotta understand and think and predict more than understanding how to stop a goal.
Yes.
I mean, it's pattern analysis, I'm sure. It's tendency. You're probably watching film nonstop on movements, and I would only assume that it's knowing if someone's going to go glove side versus stick side, what that tendency of each person who's firing the puck, and then just having to recall and memorize that once that person switches and okay, all right, what's on them, they do this, and it's seconds.
Yes.
Understanding but the differences of all of them. I'm sure it's crazy.
And it's crazy enough, even on top of that, like taking the reverse of things, like the Oiler players that they knew going into the series against the Florida Panthers that Bobrovsky had a tendency to do really well on the ground, pucks shot at the anything from waist down, but anything higher he wasn't good at. So the first few games of this series, even if they mentally knew that, even at a split second, if the opportunity wasn't there, if the defenders were good enough, even then it's going to be harder for the best athletes in the world to recall at a split-second notice. So
try to capitalize on that, you're saying.
Yeah.
For sure.
So then it goes down to pre-reps, mental visualization, and then putting yourself in those situations. Like for this last game they won, I think it was 8-1. A lot of the goals were up top, a little higher. Deflections were something, which is a whole thing in itself. But yeah, it's reading off the point, but even then there's some barriers that you have to come to the best in the world still. It's limitations. So
that's the sport of the game, right?
Yeah, it's the beauty behind everything.
So Doc, I know you are absolute diehard Connor McDavid fan.
Oh yeah.
And we have next up is how this pretty well-known world-class hockey trainer develops routines for his players. I know he's trained to the likes of Steven Stamkos, McDavid, McKinnon. I know you even knew who he was, and so I just kind of found online this program. But what do you know about this training protocol? And I guess we can go through it too after this. But any thoughts or kind of just towards Gary and what this training program looks like, and how has McDavid, made a change using Gary and those kinds of things?
Yeah. So Gary Roberts, he played professional for a while. Then he set his sights to the training aspect, and then he started training some of the higher level athletes, and then of course got some of the younger prospects that were in the junior league to work out with him for building up the purposes. That's why we see the McKinnons, the McDavids, the Stamkos, all of them. There's different summer programs that they have, which help lead into training camps to then which lead into the season. So
Yeah.
depends on where you're at, depends on each and every player, location where they're from and whatnot. But a lot of players just move for the training purposes with Gary. And I like his thought process in terms of the structured and periodization of how you can break down building up different phases in strength in different avenues. So when you look at some of his past training versus where it is now, it's adapted to be more specific in certain planes of movement. That's where I got some of these building up the planes of motion from, but that was also from other areas.
Sure.
And then stick handling, combining the mental, the puck control, the legs all at the same time, and how one can move different from one another. So you work on the mental side of things as the same time you're training in terms of the small game-like settings, and then certain like skill acquisition. So they look in terms of training-wise to build up the strength and the muscle density, and then you incorporate that into quick explosive movements that would either mimic stick handling or feet plyometric work at the same time. So like when I was training athletes, you compound a large, big explosive movement and you combine that right after within seconds to go into a quick explosive movement so you can utilize that nervous system drive to incorporate that into a fine skill movement. So you can then utilize that at a quicker pace. Then over time, you would then want to incorporate that quick skill movement at a high rep pace into a sequence of events or a combination of plyometric, explosive, quick movements, very specific to the goals or the settings that you would typically find yourself in. So forward would have different mental mind frames than a defender from goaltender, vice versa from there. So he breaks that down incredibly well. He also incorporates off-ice training, building up strength, quick agility, plyometrics to on-ice training. And then there's some recovery in terms of active recovery on and off the ice too. So he kind of mirrors those two one another, but then he helps build up a power phase, a strength phase, and that helps work into the season to where when players, especially professionals, they go into the training, they find themselves still doing workouts before and also after games as well to build up.
After even? Mm-hmm. Dang.
Yeah. Especially for building up overtime games and playoffs and stuff.
Just staying conditioned completely, 100%.
Oh, God. There's a lot there.
So I won't get into the nitty-gritty of the entire program, but if you want to find it, I found it online. It's called the Nike Off-Season Program. If you just look up Gary Roberts, I'm sure you can find it. We can maybe put some stuff on the web too, but I'm just curious, breaking this down, Doc. He starts with weeks 1 through 4 on speed and power. He then goes from weeks 6 to 9 into explosiveness, and then he ends with a training camp. So I'm just curious, the breakdown of that, do you know why that is done the way it's done?
I think it makes sense. So you build up the power and speed. And I think if he had more time for players, and this would be more for the off-season program, like let's say if you're focusing on only one sport as a youth athlete, then you can build in to the strength hypertrophy phase right before then, and then go to power, then go to explosive movements with like plyometric speed. So when you incorporate this into a sport-specific training, you want to incorporate and to build up the tissues, build up the motor units so you have those available. From there, you want to add in speed. Speed's usually the last fashion of training that you want to incorporate. You want to make sure all the movements are correct. So when we get into power phase, then you can utilize that density of those motor units of the strength that you just acquired. And then you add in less power training to more quick explosive training, which are kind of the same thing to a certain extent, but probably less on the weights and more towards hockey related quick explosive movements. And then that helps transition quicker in terms of the season training from there.
So you're saying it in your experience, hypertrophy, power, muscle density, then maybe more speed, explosiveness tends to be a better transition.
For
Like you said, he's got less time
sports,
to work with these athletes, so he kind of maybe has to skip that. But
Yes.
if you had the time, that's going to be more advantageous, you're saying.
Yeah, especially professional athletes. They get done with their season, maybe a week, 2 weeks off, then hitting the ground running. But every phase of training, when you periodize it, you want to build up for anywhere from 3 to 6 weeks of slowly building up that strength or that power, that speed. Take about a week off for the body to unload, start a different phase, starting with the basics, framework, and then building up from there. So it has a fun little arc as you keep improving. But that's most sports that you want to look at. And there's some variability depending on what the goals are of the sports. Like, for example, gymnastics is going to be more technique than it is football. And you need more football strength and you need flexibility. So then that changes things a little bit. But yeah.
So with conditioning, do you find that no matter what the phases, you're probably going to be conditioned?
You ideally want to build those in. But if you're going to build those in, you want those at the latter half of each session so you can burn out that system completely, energy system that is. So with that, as we go into the conditioning for each and every session, yes, you can utilize that, but if you're trying to build up strength, muscle density, you don't want a lot of the resources spent for conditioning because the body's just going to utilize those.
Yeah, good point.
So earlier on I'd still do some conditioning, but I'd lean towards way more heavy work on if you want to build up the tissues versus the layer end. Then you can get into the way from the power phase on quick explosive movements for less reps. You can then add in the later stages of conditioning because you then won't burn out the systems and you can still utilize that versus the latter half. Then it's going to be explosive movements, high conditioning bouts.
Sure.
But then it varies season, off season.
It'll allow for lack of better use of resource when you obviously need that for heavy lifts, hypertrophy, being able to expel that energy that way.
Absolutely.
Okay, that makes sense for sure.
Yeah.
Was there anything else you found interesting about this program or even wanted to touch on?
No, I think I really like it. If you're an athlete, especially a hockey player, I would look into this one or camps to where you can fine tune your skills, and especially the skills of incorporating feet, dynamic, explosive work with your legs and building that up. And then if you can find a place that can also do stick handling drills and communicate both of those two together, you add on top of that a world class to get the mental mind frame right and go through gameplay situations, which is even better. And I think this is actually transitioning quite well to the next topic of AI. Growing up, there's USA Hockey came out with an online software to where it mimics the gameplay situation, kind of like a video game to a certain extent. But you have certain angles, like it almost looked like a line or like a small player with the stick, and there was like X's and O's. So X's would be, for example, like the defenders versus O's, or the same tendency that your player had at that time would match obviously your team. So you had a chance to see where are the open angles, where's the open space, and not even just going towards the net, but just even playing keep away of the puck. And then to look at that and to have that translate quite well with on ice, you can even see projections of if you're going to pass in this angle, go through a pass, and then see, okay, where are the open spaces? Where does your body or your player need to move? And they go in terms of incremental steps. And I think more visualization reps that you have, just even with that video game, helps significantly for on ice. But I think that also goes playing into the enhancement of where AI is going to keep learning for us to adapt moving forward, which is going to be something quite fast.
Yeah, I'm sure all sports are using it, but I just found it really interesting that they have, in the articles that I read, it was the Maple Leafs and the Knights were the teams that were mentioned in the article. Now I'm sure other teams are using it, but the things that they are using it for, they kind of broke it down into categories, but the first one that they broke it down into was enhancing performance. So the AI programs now are able to analyze footage, which is, I'm sure, helpful if you don't have to spend the thousands of hours in the film room like you've used to. You can kind of take that time, have AI do it for you, and then you can maybe extract the more important parts, just like we use AI for.
Yep.
Now me and you aren't reading constantly all the books and knowledge that we have to read. It's just, better well extracted for us. But again, it can give you insights into other players' performance and opponent strategies, and obviously potential areas of improvement for yourself. Like, it'll pick out that. Coaches are using it to devise better game plans. AI is also what it's mentioned, training experiences to give you data while you're training. So this wearable technology that you can actually see, I think you can see what action you chose, its percent of actually completion was good or not, versus that pass was actually the lesser choice or lesser option. You had a more high percent chance of actually doing this with the puck, and it gives you that in-time game feedback. Again, it helps with, we'll get into it, but it showed for player safety and injury prevention. It was tracking those kinds of things, monitoring health, predicting injury, and just helping with recovery. But the player tracking specifically helped details for positioning, speed, puck control. It helped you pick out online combinations, player development, and just understanding your game moving forward. It used VR, again, kind of like you talked about, again, to help practice and improve skills using algorithms. But the one that I think was most interesting to me was injury prevention and health management. So it would actually detect early indicators of these players on ice and gave you analysis such as heart rate and movement patterns showing fatigue. Now, we talked about fatigue being such a crucial predictor of concussion. So these teams now have the ability to predict when players are going to either change movements, for such as a less efficient movement if they're tired, and what the signs are to see when they're fatigued so that they can pull them out of the line to help keep their longevity throughout the game. Wow. So that was so crazy. Again, it's helping minimize injury. The consistent lineup changes are helpful for maintenance, avoiding disruptions, and then it actually helps assist rehabilitation processes because they're now analyzing which programs are getting players better quicker, and then they can now personalize recommendations based off of which players return to ice faster. That blew me away. That was probably my favorite part of this, and obviously as providers, that's something that we're probably more likely going to utilize once that software becomes more to the masses, of course. But yeah, all of that blew me away, and I'm just excited to really use that as a provider. That was the most exciting for me.
I can't wait to see how the coaches, especially for the professional levels, will utilize that for optimizing their players, their systems, in-game, changing strategies to work off what their players are doing. And then even from the training aspect, like how well different people can adapt and improve. The concern I have from here is going to be, obviously there's robots being made that they're vastly learning, growing. It's going to be interesting to see the time frame of, do robots, are they eligible to play? Because if you think about it, like, people want to see the best of the best compete against one another. It's kind of like Grandmaster for chess versus a computer. It's kind of similar tactics, but that will change a lot of things in terms of the future. We're obviously away from that, but how that gets utilized with humans versus non-humans might be a completely different sport as well.
To think you might train against a robot to improve your game. Like a fully functional human robot cyborg.
Man, this part I'm actually really excited for because I know it'll built in.
I've followed this story for so long. I love this story. I got to hear it from him.
Dude, no way.
Yeah.
So
super cool.
One of the things that we're kind of reiterating about that we're super excited to bring to you is the Sidney Crosby story, from his traumatic brain injury, how he's rehabbed that, and then different ways of functional neurology that I think, going back to the concussion aspect, this brings apart a whole new level of not only training but also rehab as well. So Doc's going to do an awesome job breaking down what the injury looked like, how Crosby came back from it? What are the things that he introduced to his training, to his rehab? So yeah, Doc, take it away.
Yeah.
Dude.
So Sidney Crosby, probably arguably one of the best centers, right?
Yeah, probably top 5.
Yeah.
Probably that may have ever played.
Yeah. I'm sure after this Doc can break down just skill-wise why he's been just the best of the best. But in 2011 at the NHL Winter Classic, he collided with a Capitals defenseman, got a head injury. 4 days later, he got another hit and led to a diagnosed concussion. Now, we talked about the multiple hits, multiple concussion, why it's such a huge injury. Again, head injury, you're at a greater risk of another concussion by 4 times. It happened to him just 4 days later, already having in the period of healing another head injury. So again, it just exacerbated his issue. So I think recovery lasted and sidelined him for many of the events and days over the next 2 seasons, but getting back to even playing was quite the journey. And so in August, I believe, was when he started I can't remember when the NHL Winter Classic is, but it's in like January, February, something like that? Yeah.
As well.
So he starts in August after just continuing to have issues. He goes and visits Dr. Ted Carrick, and again, Dr. Carrick to us, he's a real pioneer of just that portion of care, and he created what was called the chiropractic neurology diplomate. And for those of you that don't understand what diplomates are, think of it as specialties to MDs, where MDs get their doctorate and they go become an orthopedic surgeon, or they go become a dermatologist, or they go become a nephrologist, or they go specialize in something. As chiropractors, we have that same ability if we want to go and do postdoctorate training and then get certified diplomat in a bunch of specialties. We talked about it on the chiropractic podcast if anyone is truly interested in knowing the difference. But Dr. Carrick created the industry of chiropractic neurology, and I mean, his wait list right now I think is 5 years to see him. I mean, crucially such a turning point in chiropractic. I love him to death. He's one of my favorite people to study just everything that he's done. So Crosby goes and visits Dr. Carrick in Atlanta, and Dr. Carrick assesses, Sid Crosby. And what's interesting is there's a part of the article that explains first meeting with Dr. Carrick, and he listens to Crosby's heart, and he basically goes, "Yeah, you're gonna live, no worries." And Crosby was like, "What?" And he kind of didn't know what was going on. And so if you ever been around him, he's very funny. He's very sarcastic and incredibly brilliant. He's got multiple PhDs on top of his doctorates. He actually has a PhD in learning. He studied how to learn quicker. That's from Harvard. Just a genius. So he assessed everything from neurologically. He did Crosby's eye movements, spatial awareness, balance. He knew something was off right away. So one of the cool things that Carrick had at that time was called a gyrostim, in which, if you haven't seen, we'll probably put pictures of it up. It's this big, almost sphere-like rotating chair that you can put through motions. It's just this computerized rotating chair, and it helps to enhance the brain function, eye movements, those kinds of things. It works the vestibular tracts really, really well. So he did a lot of that with Sid. On top of that, he used the CAPS machine, which I had talked about previously, to help with stability and fatigue. He did kinetic eye movements, nystagmus movements like we talked about. He used, again, video nystagography, which, again, I touched on. There's a lot of other higher tech, lower tech exercise things that he did, such as proprioception, balance, movement work, you name it, this man did it. And Carrick was known for what was called his intensives. So it's a 5 or 10 day program that you could come to Atlanta and do with him. So obviously, if you're not in Atlanta and you're not going to do a 3 times a week for so many months program with him, it's not feasible for some people. Yep. So he had these 5 or 10 day programs where you'd come and train with him 4 to 8 hours a day. Dang. And you'd do that every day for 5 days, and then you'd leave. And hopefully then you'd obviously have huge improvements. But it works in these settings because, like I said, with concussion, you have such a small window of opportunity. And it's crucial in the beginning stages to get training done and get rehab done early on. So he would talk about how he would do multiple sessions each day. I think he did 2 weeks total. And throughout the training, he was assessing him daily on computerized tests. He did objective measures to make sure that things were improving. And I think after the 2 weeks, he would follow up with him routinely, but 3.5 weeks after, he was cleared for contact. And it was this final step that actually allowed him to return to competitive play.
Wow.
2 weeks. And he had been dealing with this for so many months.
Wow. That's crazy.
He obviously maintained contact with Dr. Carrick after for, prescribed exercises and treatments, but I think it took a total of 10 months for him to be able to return to play. But not only did he come back stronger than when he started, Crosby said that. He said, I think I'm better than what I was prior to, yeah. And, to not have that end your career, having that ability to go and see a professional like Dr. Carrick, I think changed everything for him. So, yeah, I know another gentleman, Dr. Schmo in Minnesota, has seen so many athletes, especially hockey players, with the same story.
Yep.
They'll come discombobulated, not knowing anything, feeling like the injury is going to, change their whole life. And he's got a gyrostim too. And he goes 2 weeks later, just incredibly better and able to actually get back into the game. And this maybe isn't going to be able to be a step for every NHL player who has a concussion, but this is what it's going to take as far as effort-wise. Understanding that it's going to take intensive rehab. And you don't need a gyrostim to get to 100%. It's just you got to understand the effort it's going to take rehab-wise, eye movement-wise. Go see at least a professional who understands it at the basic level so that you can get back to normal. That's what it's going to take. And Doc, I know I said I'd follow up. We were going to talk just real quick because I was curious. But Sid Crosby, what separated him from being the best? And his incredible stick handling and just understanding the difference between someone like him versus, maybe a more mid-level NHL player. Why was this such an incredible story for Sid to keep at it and play to the continuation he did?
God, you look at him in his early career, like when he first started off, he put up 120 points a season. At that time was a lot. So, and he was really good with like his mental mind acuity of where his teammates were at. He could score in any position, especially around the net. So going into his draft year, it was Crosby and Ovechkin. Now the differences between those two and why the rivalry is as it is between Penguins and Capitals is because of those two for over a decade now. And Ovechkin has the shot, and I'm hoping he passes Wayne Gretzky's record for most goals ever competed by a player in their career versus Crosby, to where he had a mixture of goals, assists. The one part that sticks out for him is he made all of his teammates better. He's an awesome leader. So he pretty much elevated the players around him that maybe are not professional or very like fourth line players, to where they're scoring 20, 30 goals a year, which is a whole heck of a lot. Improving all their careers at the same time as winning a couple of Stanley Cups as well. So all things considered, between, I think it's over 1,500 points, multiple championships, bringing the intangibles in to having the leadership, improving the people around him. I think all those combined together to make him one of the better athletes, hockey players that has probably ever come through the game.
Yeah.
Other broadcasters are saying he should be potentially on the Mount Rushmore of hockey players, up there with Gordie Howe, Wayne Gretzky, Mario Lemieux. Like, all these players have their own tendencies and high-level world-class strengths that they had.
Almost a tier.
Like
they got a tier of their own, right?
Oh, God, it's unreal. So, like, when I was looking back at the concussion, the traumatic brain injury, looking pre and post, there was a little bit of similarities and a little bit of differences in terms of his speed. That diminished a little bit, but his mental awareness afterwards improved significantly, and he was able to pass, so he got way more assists versus goals to a certain extent were about the same before and after. But I think that's also with the eye training, with specifics that Carrick did with him. Crosby had to rely on the teammates, his leadership skills, and just mentally and improving the mental IQ of his game, which then causes him to adapt and change as the time went on.
Right.
But yeah, because like when he first started off his career, that game of hockey is more quicker now and a higher pace, to where he's even at like, I think he's like 36, 37 years old or so, which is high, is older for most athletes, especially for hockey. For goaltenders, you can see is upwards. I think the oldest right now is Fleury at 41. And then anytime you get 35 and up right now, it's hard to maintain a long career.
So he's still playing at 37?
And he's doing damn good. He almost led his team, the Penguins, into the playoffs, but people around him. So he's doing this at many different levels. So thinking if Carrick wasn't available, the Pittsburgh Penguins, they wouldn't be where they are today.
That's unreal.
It changes the whole dynamic. And then going back to Carrick University, man, that talk about the highest level of tier for, I would assume, any neurological credentialing for any type of discipline.
Agreed. Seriously.
The tools are unreal.
And I'm not here to pick out who's better or not in providers, because again, that's each of us have our skill set and talents, and but I have never met more talented, qualified diagnosticians than chiropractic neurologists. Seriously, like, and I pride myself on making sure that I can pick out what's wrong with a patient. I mean, we all do, right? But it's just another level. It's another level, and it's just fun to learn from them. And I do hope to one day become a chiropractic neurologist and start that training myself, because it is something that I've been looking forward to ever since I heard about it. So, but yeah, Carrick and Crosby are like the perfect like for each other, right? Like once in a lifetime talents for each of their industries. So it's kind of funny.
Yeah. And we might be a little biased, but we look to the best of the best in every facet of the medical system, of every facet of anything personal development wise. Because like if we're going to bring knowledge and value, like we're not going to be blind leading the blind of us learning from someone else that have a little experience, but they're not the best. Like, if we're going to not waste our time, we're going to go straight to the top. We're going to learn as much as we can. And even with some of those classes for the Carrick University that Doc brought up, like the classes are thousands of dollars.
Yes.
Like not only for the time frame, but also for the financial.
For me to get started, it's about 10 grand just to get started.
This is after being a doctor of chiropractic, after graduate school.
And can't wait to get started, to be honest.
Yeah,
Cannot
you're
wait.
So good at that,
So,
man.
but yeah, anything else with that, Doc?
No, that was perfect, man.
But yes, that was the Bulletproofing the Hockey Athlete podcast. Guys, thank you so much for listening in. We appreciate each and every one of you. Super excited to continue on with more of these. If you guys are interested in any more, just let us know. We appreciate each and every one of you. Thank you so much for continuing to support us. It means a lot. And we look forward to hearing from you guys moving forward. Until next time, Doc.
Woo!
Have a great day.
Disclaimer, the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the Functional Code. Until next time, stay well, stay informed, and embrace the science of living well.